when somebody's planning a VBAC, so vaginal birth after cesarean, and they're told, well, in case there's a rupture, we need you to have an epidural so that we can immediately intervene. And that seems crazy to me. The risks associated with an epidural in that scenario for someone who doesn't want them outweigh any potential benefit of getting the epidural to decrease rupture risk because the risk of rupture is so low. But then we have the other side of things, which you just mentioned, like the idea that if a baby is in a funky position and we get an epidural, maybe it'll help the baby to have a vaginal birth, to be born vaginally. And I think there's probably some validity to that, but I think it depends on the reason why the baby is asynclitic or deflex. Like sometimes people are creating a lot of tension in their pelvic floor. Again, like that rectal pressure is happening. Sometimes if we're spending a lot of time in standing positions, our desire is to just like tighten up with that rectal pressure. And then we may be preventing the baby from having that space to kind of navigate their way down and out. And then also, if we are being restricted in our mobility, then we may not even be able to like kind of explore the different positions that might help create the space for the baby's head to shift. And then I think too, when people don't necessarily have the coping tools to like sink into their contractions and embrace their contractions, then a lot of times again like that tension and that lack of rhythmic movement may be kind of keeping the baby in a funky position